Injuries are the leading cause of death in children over the age of 1 in the United States. Unintentional injuries, like traffic injuries and drowning, along with intentional injuries, such as firearm injuries, lead to more deaths than heart disease, cancer, and influenza combined. Despite many years of focused interventions, significant inequities persist in who is injured by race, geographic location, and socioeconomic status. For example, Black children die from injury at 4.5 times the rate of Asian American children and 2 times the rate of white children. American Indian children die from injury at 3.5 times the rate of Asian American children and about 1.5 times the rate of white children. Children in rural communities die from injuries at 2 times the rate of urban children, with higher rates from multiple injury mechanisms, including motor vehicle crashes, drowning, fire and burn injuries, and suffocation. And poverty worsens each of these inequities. To analyze the root causes of inequities in fatal and non-fatal childhood injuries, and to better understand how to address them, we developed the Massachusetts Pediatric Injury Equity Review, known as masspier, a new process for reviewing and addressing inequities in injuries. masspier is led by a multidisciplinary team of experts in injury surveillance, child fatality review, legislative advocacy, and more. Over the past year, the masspier review process was used in Massachusetts with 3 local child fatality review teams in Suffolk, Norfolk, and Middlesex counties. The team focused on drowning and traffic injuries, 2 injury mechanisms with prevalent and well-known inequities. Let's take a closer look at how masspier was used to study traffic injuries. In a Middlesex County Child Fatality Review meeting, we reviewed fatal and non-fatal epidemiologic data provided by the Department of Public Health for Middlesex County and the state of Massachusetts from 2016 to 2020. We found that Black, non-Hispanic, and Hispanic patients were more likely to sustain non-fatal injuries from pedestrian or motor vehicle crashes that led to a visit to an emergency room when compared to white non-Hispanic patients. Next, we reviewed publicly available GIS mapping data to study the location of fatal injuries. Then we created a shared injury equity matrix for traffic injuries with the contributing factors of inequities identified by a research team literature review. The Injury Equity Matrix is a working tool developed by the masspier team using the foundation of the Haddon Matrix to describe underlying factors that impact injury outcomes. Finally, we reviewed the data and discussed recommendations. The Boston Medical Center team worked with the Department of Public Health to give each recommendation an equity score and identify associated legislation, policy, or programming, and the agency responsible for implementing the recommendations. A sample of proposed recommendations include better identify and address high-risk areas that may benefit from built environment changes such as speed tempering interventions, narrower roads, and/or changes in crosswalk and intersection design. Identify the availability of free driver education courses in languages other than English with advocacy to increase access if needed. And increase the availability of free multilingual CPR training in communities of color. The masspier process was created to be sustainable and scalable, allowing other states and counties to use the process in their communities to review cases with any type of injury mechanism or injury inequity.